2-minute anaesthesia, clinical, postoperative nausea and vomiting. Postoperative nausea and vomiting remains a significant problem, with the incidence varying between institution and country. However, a recent meta-analysis over 10 different countries identified an incidence between 15 and 30%. It remains the most common reason for patients requiring an inpatient stay overnight following a day case procedure. It's clearly defined as nausea and vomiting, usually before 24 and 48 hours after the procedure. Risk factors for PONV can be classified into patient, surgical, and aesthetic. Anaesthetic includes the use of volatiles, nitrous, opioids, and dehydration. Surgical factors based on the site of the surgery, if it's significantly painful surgery and prolonged procedures, and then patient factors, female, young, during, after menstruation, pregnancy, obesity, personal or family history of PONV, or even motion sickness. The Apfel score is a useful and simple tool for stratification of patients who are high risk of PONV. It includes 4 variables and you get a point for each: female, non-smoker, motion sickness, postoperative nausea and vomiting. You add up the number of positive results, and this relates to the risk of PONV and also the number of antiemetics that patients should receive. Once you've adequately risk stratified the patient, one should implement a management technique based on the patient's risk of PONV. First of all, reduce the risk, including regional techniques, TIVA-based anaesthetics, hydration, avoid opioids, anticholinesterase, nitrous, prolonged starvation, and ensure good communication with the patient. And finally, drug treatment, antiemetics. These will be covered in additional talk. However, one should use a combination of drugs with different mechanisms of action. The lower table shows the risk reduction related to the number of antiemetics. A single individual antiemetic reduces the risk by approximately 20 to 40%. However, second antiemetic are not synergistic, they're additive, so the risk reduction is still around 25%. PONV can lead to multiple complications affecting the patient, the surgical site and the organisation. The patient can have a bad experience leading to poor future engagement, psychological distress, aspiration, increased intraocular intracranial pressure, hypovolemia and electrolyte disturbance. Surgical could have wound breakdown, delayed nutrition affecting the GI function, and the organisational, prolonged hospital stays, cost and bed occupancy effects.